My topic is feasibility of single-stage full endoscopic interlaminar translaminar spine surgery in multi-level degenerative lumbar spine pathology. A technical note and initial clinical outcomes. Well, degenerative lumbar spine is the most common indication of spine surgery. Often the pathologies are multi-level and multifocal. Traditionally, open laminectomy with or without instrumentation has been mainstay of surgical treatment. In the realm of minimally invasive spine surgery, most surgeons rely on the use of microscope for management of such pathologies. While a single-stage full endoscopic interlaminar or translaminar spine surgery is a promising minimally invasive technique for managing multi-level degenerative lumbar spine pathologies. And we would like to find therapeutic feasibility and short-term clinical outcomes of our technique in multi-level lumbar spine pathology. Well, it is a retrospective study. Patients operated at Short Mirage between July 2023 and June 2024 were included. All patients underwent more than one level of full endoscopic interlaminar translaminar spine surgery. VAS scores and ODI scores were noted. Well, a stenoscope of 6 working channel with 15-degree field of view was utilized. Rest of the instruments are mentioned. Excess minor clearance was performed by a fellow, and rest of the surgery was performed by an endoscopic spine surgeon with more than 8 years of clinical experience. When all surgeries were performed under GA in prone position and less than 1 centimeter of skin incision was given. While a single incision was utilized for a single level, like in first figure, the patient is lean and less lordosis, so we have to utilize a single incision for single level. But if the patient is obese and more lordosis, then we can utilize a single incision for multiple levels. While scope of surgery at single level, through a single incision at one level, we can do ipsilateral decompression and disectomy. We can also perform contralateral decompression and disectomy, and we can also perform contralateral foraminal decompression. And post-operatively, all patients receive antibiotic and analgesia, drain removal and mobilization within 24 hours, discharge within 24 to 48 hours, and post-operative antibiotic NSAIDs for 7 days and pregabalin for 1.5 months, follow-up at 1.5 and 3 months. Coming to the results, there were a total of 28 patients, out of which 21, that is 75%, were female. Mean age of the patient was 60 years. 26 patients underwent 2-level surgery and 2 patients underwent 3-level surgeries, including 1 patient having interbody fusion. Average operating time was 134 minutes for 2-level and 191 minutes for 3-level surgery. There were negligible blood loss, uneventful surgeries, and all patients were discharged within 48 hours. There was a statistically significant decrease in VAS score for both back pain and neck pain. And also there was statistically significant improvement on ODI scores at 1.5 and 3 months post-operatively. Coming to the complications, there were no major complications. 5 of the 28 patients had residual sensory symptoms, which were managed by oral medications. 1 patient had persistent back pain at 3 months, which was managed by medial branch rhizotomy. There were no incomplete surgery, no dural tear, no epidural hematoma, no neural injury, no infection, and no revision surgery. So we can say that in conclusion that single-stage full endoscopic interlaminar spine surgery has potential of effectively managing multi-level degenerative lumbar spine pathology. It is a clinically effective and doable technique. There are no major complications in experienced hand. It can be a better alternative to microscopic surgery. But at last, larger studies, larger sample size, and randomized clinical trials are definitely warranted for such technique. Thank you.